Okay. Um, so the HIPAA privacy rule, also called the Standards for Privacy of Individually Identifiable Health Information, and provide the first nationally recognizable regulation for the use/disclosure of an individual health information. So essentially, the privacy rule defines how covered entities use individually identifiable health information, or the PHI, and it covered entities in a term often used in HIPAA compliant guidelines. So we'll get into that. Let me grab a glass of water. Hold on. Sorry about that. Okay. So a covered entity is a health plan, healthcare clearinghouse, and healthcare provider. And you say, what's a healthcare clearinghouse? And that's usually a data storage. It gives patients, so HIPAA, the overview of the privacy rule. So it gives patients control over the use of their health information. So if you don't want your PCP to have access to information, you can control that. And that's all in the consent to treat in the PHI agreement. Oftentimes, access to certain stuff you have to request. I'm sure for some of you who work in the VA, you know that even though VA uses Epic, it's not Epic accessible. You have to send like this very long request, and lots of signatures have to be exchanged, and then you can get the information. And that's important for many reasons. Defines boundaries for the use and disclosure of health records by covered entities. So part of this is protecting you from disclosure of your health records to potential future jobs, life insurance policies, especially when it comes to genetic information. I mean, you can't lie to your health insurance policy. You can't. But there is some stuff that's protected and prohibited for them to know. It establishes national level standards that healthcare providers must comply with, and helps to limit the use of PHI and minimizes chances of its inappropriate disclosure. So only the bare minimum of information is going to get shared. Strictly investigates compliance related issues and holds violators accountable with civil or criminal penalties for violating the privacy of an individual PHI. So one part of this too is your social security number. We use different identifiers in hospitals. We use MRNs, right? And even with insurance companies, they use member ID numbers, because just the exchange of social security numbers willy-nilly in the air in technology is dangerous, because once that gets hacked, somebody's identity can be completely compromised. It strictly investigates compliance, so compliance-related issues, and holds violators accountable with civil or criminal penalties, so civil meaning money, criminal meaning jail time, for violating the privacy of an individual PHI. And I'll tell you what, a lot of people lose jobs over HIPAA violations. Just sometimes it's what the hospital needs to do to make a civil issue go away. So it supports the cause of disclosing PHI without individual consent for individual healthcare needs, public benefit, national interest. So, for example, syphilis is one of those reportable diseases, right? Not only is it reportable on the person, it's reportable to all their sexual contacts. And that's obviously because we need to protect people from getting neurosyphilis, which is really deadly and terrible and can be violent, for things about public benefit. Now, not saying they're going to release John Doe has syphilis, let's put it on the news so nobody comes in contact with them. But also think about Ebola outbreak. So technically, going on Facebook and saying, oh, my patient had typhoid fever today, that is technically a HIPAA violation. Did you identify a patient? No, but you identified the location where you work, who that person's healthcare person was, because that's you, and what a potential patient had. But when there is a case of typhoid outbreak And it benefits the public to know that at University Hospital, there are 15 people with typhoid fever, and maybe this could become a communicable disease problem. We can release that information. Again, did we share the patient's name or anything like that? No, absolutely we didn't. But you still have to be mindful of what and where you share information, because it is all protected. And so sometimes it's hard, right? It's hard in healthcare when, and with this age of social media and oversharing about what you say. So you just have to be really careful. All right, so here are here are the references. And I just want to mention a few more issues. So um, with informatics, I talked a lot about HIPAA, and I know that some might say that's not the only part of informatic ethics that had to be discussed. There's obviously some bioethics that we could get into further, but I feel like that would best be saved for your ethics class. So just really quick, I do want you guys to just remember pages 76, or sorry, 73, where it talks about theoretical approaches to healthcare ethics, and it talks about principlism and the four guiding principles of bioethics, which is respect for autonomy, non-malfeasance, beneficence, and justice. So autonomy refers to an individual's freedom from controlling interferences by others and personal limitation that prevent meaningful choices, right? So people's right to make decisions for themselves. And that's kind of what HIPAA does. It gives people a right to make decisions and control their information. Non-malfeasance asserts an obligation not to inflict harm. So that kind of comes into play when we talk about when we can share things for the good of the public, for the good of research. But of course, we're protecting someone's autonomy in that as well. And negligence is a departure from the standard of care. So if we're negligent in the way we protect information, that is going to violate our ethical accountability to our patient. So beneficence refers to actions performed that contribute to the welfare of others. So it's positive beneficence, and that requires the provision of benefits. And utility requires that benefits and drawbacks be balanced. And one must avoid negative beneficence, which occurs when constraints are placed on activities that, even though they might not be unjust, could in some situations cause detriment or harm to others. And so with beneficence, we talk about doing good for our patients, doing well. So protecting their future information, protecting them so that they can get better jobs, and having access to information so that we can take care of them better. And then justice refers to fair, equitable, and appropriate treatment in light of what is due or owed to a person. Okay, so that is it on ethics. I know I went over into the second week on it, but I just wanted to make sure we had a thorough discussion on informatics and ethics, just because it really is kind of the new dawn when we talk about ethical issues in healthcare. I mean, aside from treatment issues, there's stuff that's just pools deep when we discuss that area.